You are listening to the Keep the Weight Off podcast with Dr. Angela, episode number 69.
Welcome to the Keep the Weight Off podcast, where we bust all the dieting myths and discover not just how to lose weight, but more importantly, how to keep it off. We go way beyond the food, and we use science and psychology to give you strategies that work. And now your host, Dr. Angela Zechmann.
All right, so welcome back, everyone. This is part 2 of our 2-part series with Dr. Angela Golden. Say hi, Dr. Angie.
It's so good to be back with you.
Yes, it's wonderful. So last week, for those of you who did not hear last week's part 1, we're doing the top 10 obesity myths. And this happened because I heard Dr. Angie, give a talk at the Obesity Medicine conference in Atlanta. It's probably been 3 or 4 weeks now ago, I think.
Yeah.
It's been a little while. Yeah. It was a great talk. And so I found her later at a function and I said, would you please be on my podcast? Because so many people don't know this stuff, including a lot of obesity medicine specialists, frankly, and certainly a lot of your healthcare providers and most people who struggle with this disease. And so she said she'd be happy to be on the podcast. So last week, we talked about the first 5 obesity myths. Now, if you weren't on last week, I just want to tell you who Dr. Angie is. She has a doctorate in nursing, and she has an obesity medicine practice in Flagstaff, Arizona. But she's a primo educator for those of us in obesity medicine and for nurses all over the country and all over the world. She is the past president of the American Association of Nurse Practitioners, which is the group for nurse practitioners in the country. She gives talks all the time. She's a consultant in the development of patient education materials. She's done all kinds of research. She's authored a book. I mean, this woman knows her stuff and is very happy to teach it. And so I'm just absolutely thrilled to have her on the podcast with us. So thank you again, Dr. Angie.
I'm so glad to be with you.
Yeah, I want to just review the first 5 obesity myths that we talked about last week for people who hadn't heard of them. The first obesity myth was that obesity is a risk factor and not a disease. And so we talked a lot about how, it actually is a disease and it is associated with a lot of poor health outcomes. So we talked about that. Myth 2 is that it's all about willpower. And so we talked about some of the neurochemistry of this disease and how it is not willpower that is creating the problem. Myth 3 is that we use diet meds to treat it. And we talked about how these are not diet medications at all. These are medications that are helping to correct the neurochemical imbalances that create this disease. Myth 4 is that you have to lose a lot of weight in order to have any benefit. And we dispelled that myth with data and research. And then myth 5 is that I can't change it because it's all in my genes and it's all hereditary. And we talked about how that's not true either. So those are the first 5 myths. And if you want more information on those ones, go back and listen to last week's podcast. But let's start now with myth 6. So what's myth 6, Dr. Angie?
So myth 6 is that surgery is cheating. And, I think what's interesting is I don't know any other disease process that surgery is part of the possible treatment paradigm that we would ever call it cheating. I mean, think about coronary artery disease. I mean, you have plaque in your coronary arteries. Nobody says, oh, you had bypass surgery? What a cheater you are. I mean, nobody would ever say that. They would be like, oh my gosh, you had to have coronary artery bypass surgery. So, you have clogged arteries. People expect you to, have to have some kind of intervention. But we don't talk about bariatric surgery that way. So I think what's important for us to talk about how that bariatric surgery works. The two most common bariatric surgeries that are happening in the United States right now are the Roux-en-Y gastric bypass and the sleeve gastrectomy.
Mm-hmm.
And I think what's fascinating is that, for a long time, people just said, they just make the stomach smaller.
Yes.
I've
heard that so many times.
There's no question that they do that. But really what they're doing is they're affecting the gut-brain communication. So they seem to be lowering that defense of the higher body fat mass. They're changing how the hormone and the brain talk to each other.
Yes.
So appetite is decreased, and it happens almost immediately after surgery. So it can't be just about decreasing the size of the stomach. So we know that this is happening right away. And so I think, to me, that's been one of the most fascinating things to keep in mind about bariatric surgery as one of the tools that can treat obesity. It's not the only tool any more than medicines are the only tool.
Right.
But I think the audience should know it's one of the tools, and it's certainly not a way to cheat.
Right. Yeah, I hear that all the time that, that'd be taking the easy way out. But then there's all of these risks to surgery. And then people don't think about the risk to obesity out of control when they're considering the risk to surgery, which these days are quite minimal because they do so much of it laparoscopically too.
Right.
So,
in fact, I think the risk right now is 0.03%, which is less than having your gallbladder removed.
So there you go. It's less risk than a gallbladder surgery. And it's a bona fide treatment option.
It is. Yeah. And I think the way we can look at that is to say how it impacts the disease. So when we look at bariatric surgery, a couple of examples that I think are big impacts are 83% of type 2 diabetes can actually be completely reversed with bariatric surgery, and 92% of high blood pressure.
92% of high blood pressure can be resolved with bariatric surgery.
Yeah.
Wow. Yeah.
And even 55% of migraines are resolved. So when you think about that, I mean, people don't often think that their bariatric surgery, again, when we treat obesity, as you well know, we're doing much more than a number on a scale. That's not why we're treating it. We're trying to impact all the things that obesity causes, like we talked about with myth number 1, which was we're trying to prevent all the things that obesity causes.
Yeah. Yeah. And it's so interesting because we hear over and over again in our conferences about how people who have obesity and are eligible for medical treatment or bariatric surgery, they're just not being told this information. Typical healthcare professionals don't understand the disease of obesity, and they certainly do not outline the potential possible treatments for people. And so it gets to be really, really frustrating for them. So we just want to make sure that everybody listening to this podcast, and if you're listening to this podcast and you're like, wow, this is really interesting, I've got friends who need to know this, by all means, share it with them, because we want people understanding what's going on with this disease.
And I would say it's the majority of your audience, because only 3% of people with obesity get the choice of having a medication, and only 1% of those qualified for surgery are ever referred for surgery. What other disease?
I know. Well, that's because it's a willpower problem.
Exactly.
Right?
Not
at all. We talked about that last week, if you didn't hear it last week. All right.
Yes.
So I'm so glad to hear you say that surgery is a really viable option and is not risky at all. So that's awesome. Okay. So what is myth number 7?
Just exercise more to lose weight.
You are singing my tune.
And I always feel bad for so many of my patients who come in and they'll say, I exercise every single day. Why am I not losing weight? And my heart breaks for them, because I know how hard they're trying to control their disease. And most of it's because they don't understand the disease. And here's what we know about exercise. If you are actively trying to lose weight, it can only provide a modest amount of weight loss. In fact, only about 5 pounds on average. So, and then we're going to add a little bit of insult to injury here, because when you do bouts of exercise, you often increase your sedentary activity the rest of the day.
Yes.
And some of us, I know I've been guilty of this every once in a while. We think, oh, you know, I rode that bike for an hour at the gym, so I can have a little piece of cake tonight. We think we can eat more. And
you know what I call this? I call this the exercise halo effect.
Yes.
And I don't know if I made that up. Yeah, it's like you have this like, ta-da, I did so well on my treadmill this morning or my bike or whatever it might be. I get to eat, you know, and so.
Yeah. The exercise also increases the hunger hormone ghrelin. So sometimes after you exercise, you really are hungrier.
Yeah.
It's not just that you think you can eat more, but you really are hungrier. So, but I want to be really cautious here. I don't want anybody in the audience to think that you and I are telling them not to increase their physical activity.
Right.
Because activity is good, and it's good for many, many diseases. We know it improves blood pressure. It improves glucose control for people with diabetes. It's great for the prevention of obesity. And your podcast is Keep Your Weight Off. Activity is 50% of maintenance for obesity. It's how you keep the weight off. So activity is very, very important. But for keeping your weight off, we're talking probably close to 300 minutes a week.
Yeah.
That's a lot. And people will look at me and go, you have got to be kidding. So I think the key is for everybody to realize that all movement is good. So just get up and move. If you're sitting there right now listening to this, get up and walk in place. Walk around your house. Listen to the podcast while you're out. I mean, right now here where I live, it's 73 degrees.
Oh, lucky you.
We should probably be out walking while I'm taping this, except there'd be too much background noise.
Exactly.
But, you know, I think that wherever you can get some extra movement in, it all adds up. It doesn't have to be a concentrated amount of time. And I think that that's a really important take-home message. It doesn't have to be exercise. It can just be activity.
Yeah. Well, you know what I discovered is that exercise really helps. It really helps me personally with my mental health. Because I feel so empowered when I'm exercising regularly. And that gives me the motivation that I need to chop my vegetables and cook my food and do all of those other things for me, because I know I'm taking care of myself. And I see this really consistently with my patients too. When they're exercising, even if they know that, you know, it's not going to be the calorie burn that matters, they know they're taking care of themselves and they're feeling empowered and motivated. And that's just a really, you know, among all of the other things that exercise does for us.
Yeah. And I think that's why it's important for people to think of it as activity. And, you know, if they're a desk worker, you know, there's somebody that's at their desk most of the day, set an alarm so that every hour they get up and move for 5 minutes. Yeah. Every time they do that, they can recognize that empowerment of, I did this for me.
Yeah. Now I have a quick question for you. You know, all those smartphone apps that people have where they're calculating how many calories they should eat every day. And if they go out and they take a walk or whatever, and let's say they burn 300 calories, it adds an extra 300 calories to their daily intake. What do you think about those?
I hate them.
Okay. I do too.
So I have a desk cycle, which means that when I'm sitting at my desk and I'm working on creating a talk or somewhere, I'm usually riding my bike, and I'm not really sure where the app thinks I live, maybe on a different planet, because it will say that I've used 800 calories. Well, there is no way on earth that I used 800 calories. I even put light cycling. And I can't eat 800 more calories that day. Give me a break, right? So I tell patients to totally ignore the added calories because
I do too.
It's incorrect. I don't know what calculator that the programs use, and they all do it. It's not just one program that does it. They all do it. So I just tell them they just ignore that.
Yeah. Excellent. I do too. I just am like, you know what? Your body is not a simple math formula. It just doesn't work like that.
Yes. Which actually takes us to myth 8 wonderfully.
Okay, great. What's myth 8?
Calories in and calories out. Fewer calories and exercise more. It's that simple.
Yes. Okay.
It's not. It's our bodies are not a math calculation, as you just said.
Mm-hmm.
In fact, if it was that easy, we wouldn't have the obesity problem that we have.
Mm-hmm.
One of the premier obesity physicians in the United States is Dr. Robert Kushner.
Mm-hmm.
And he likes to talk about obesity treatment is well beyond diet and exercise.
Mm-hmm.
And I love using that because I think so many of the people in your audience and many of my patients come in and they think it is truly just tell me what diet and how much exercise to get. And that just isn't what it is. Let's face it, we don't tell anybody with diabetes, just eat less sugar.
Mm-hmm.
Or somebody with hypertension, all you have to do is eat less salt.
Mm-hmm.
Both of those can be part of what we talk about, but it's not the only thing we talk about. So we need to use all the tools in our toolbox to help treat the disease of obesity. So we talk about making changes in lifestyle, and absolutely that can include changes in eating.
Mm-hmm.
It can include increasing activity, and it can include working on sleep and stress and adding appropriate medications.
Yes.
But we don't do that with obesity. As a general statement for healthcare providers, we don't put all of that together for obesity.
Yeah.
So I think one thing that we have to get rid of is this misconception that it's simple calorie math. Because, the urban myth is that 3,500 calories is a pound of fat.
I love the way you said that's an urban myth. I love that.
Yeah, it is. Because if it was true, over a course of a year, it would either equal a 52-pound weight gain or a 52-pound weight loss if I reduced my calories by 500 calories a day.
Mm-hmm.
And that clearly doesn't happen. You've had patients, I've had patients, your audience has done this where they have reduced their calories by 500 calories a day and they did not lose 52 pounds that year.
Right.
The 3,500 calories came from Dr. Wishnowsky in 1958.
Mm-hmm.
He was a medical researcher, and all he did was try to find out how many kilocalories did a pound of fat store.
Mm-hmm. He
wasn't trying to find out how much food you had to eat, how much food you had to burn. Mm-hmm. And we have things, there's a, and I don't know if in your notes you can put in links or not, but there's something called the NIH Body Weight Simulator. And it's a calculator that takes into account what we call metabolic adaptation.
Oh,
and it will show your audience what can they really lose when they take into account eating and activity. Mm-hmm. So it's a nice way. You can just Google NIH body weight simulator and it'll pop right up. Or
we can put the link in the show notes too.
Perfect.
Yeah, we can do that.
But I think there's another thing that people are never aware of that just really kind of adds to the confusion. Mm-hmm. Many of us have become very astute at reading labels. Mm-hmm. But the FDA allows a 20% margin of error on a label.
20% margin of error. So
something that is 150 calories on the label could really be 130 or 180.
Oh my gosh. Wow. Yeah,
so
that's a lot.
I think, and I think that when we add to that what we're learning about our gut, our intestines,
Mm-hmm.
and that if you put two people next to each other, one who's never had obesity and one who has, the person with obesity actually absorbs food differently than the person who doesn't. And it's because of the way that the gut is impacted by inflammation from obesity. So more calories are absorbed by the intestines of someone with the disease of obesity.
That's
so
interesting.
that you can see, I mean, I think it's really clear that a calorie isn't just a calorie.
It's very clear. Yes. Yes. And I have also attended lectures where they talk about some people have different gut bacteria. People with obesity have different gut bacteria than people without obesity. That can affect the way foods get pre-digested and absorbed. There's so many other factors. I wish it was as simple as calories in and calories out, but dang, it's just not.
You and me both. Although we might be out of a job, but that would be okay with me. Yeah. I would actually be okay if it was that easy for everybody.
Yeah. Oh, man. All right. So, okay. So that's myth 8, is that it's not as easy as calories in and calories out. What is myth number 9?
What's the use? It all comes back.
Oh, this is so hard. And this is the Keep the Weight Off podcast. So let's talk about this.
So as a woman who lives with the chronic disease of obesity, I've always laughed and said that every time I lost 15 pounds, it went out and found 5 friends and came back. And, you know, the reality is I always blamed myself. I said it's because I didn't have enough willpower. Well, I've debunked the willpower myth. So now let's debunk this one.
Okay.
What we have learned about the disease of obesity is that there's something called metabolic adaptation. And once we have this disease, our hypothalamus, an area in the brain, actually begins to defend the higher amount of fat mass as the normal in our body. Yes. So when we lose weight, it actually defends the higher mass and says, oh, no. You need to eat more.
Yes.
And you need to not move as much.
Yes.
So the brain is actually telling us by increasing the amount of hunger hormone and not being able to hear the satiety hormone as well. That's called metabolic adaptation. And so all these times, and I'm sure many in your audience have experienced this, they've lost weight and then they've gained it back. Now, I don't want to pretend that part of it isn't because I did start to eat again. And some of it is, I swear I call it calorie creep, where it's really not very much, but 100 calories here, 100 calories there, but it's because my hunger hormone is higher.
Yes.
So with that in mind, people need to realize that there is a biologic adaptation occurring that increases the hunger hormone. It's more than willpower. It's a biologic occurrence that's causing that increase in hunger. And are there things we can do about it? Yes, there are. We can use macronutrients like protein to help offset that. But we can use medications to offset it.
Yeah.
I also know that if I go back to tracking my food carefully, I can see the calorie creep come in. Or I can see that I'm not moving as much if I go back to tracking my activity. So I can use my behaviors to help work on it. But, I also make sure that I've kept my quarterly appointments with my obesity specialist.
Yes.
So that I continue my treatment of my chronic disease.
Exactly. Yes. Yeah. It is so interesting. You can't underestimate the fact that you live in a society where everybody glorifies overeating too. Like we're always overeating as a society.
Yeah.
And we're eating a lot of products that contain a lot of sugar and flour that are going to reestablish sort of a new baseline in our brain for whether we're sensing satiety or not. And so that's why the protein is so important. Like if you replace the sugar and flour products with more protein, then you bring the leptin levels back down and you increase the satiety hormones more. You bring the insulin levels back down so that you can increase the satiety hormones. But they did a study on Biggest Loser patients where they discovered that even after they had attained a steady state, their basal metabolic rate just kept going down too.
Mm-hmm.
And that's part of that metabolic adaptation, is it not?
It is. And that's why keeping your lean muscle mass through weight loss and keeping it as high as you can with maintenance is so important. So that's why for people in the audience that are seeing an obesity specialist, or you've been fortunate to find a primary care provider who understands obesity, they've talked to you about anaerobic or weightlifting. It's to keep that lean muscle mass as high as you can, because the more muscle mass you have, the higher your resting metabolic rate can stay. So, and that Zechmann study on the Biggest Loser that you mentioned, I think one of the keys there is that they studied those people 6 years later. It wasn't just 6 months, 6 years later, and their basal metabolism rate, that furnace that burns all the time, was lower. Even with the weight regain, they still had a lower metabolic rate. And that's because of the disease of obesity. It's not because they have too little willpower to keep their metabolic rate faster.
Right. Well, in my opinion, it's also just because when you're doing something like Biggest Loser, you're so focused on really fast weight loss, starving the body. I'm always preaching about how important it is to make sure that we do not put our body into a famine state, that we are feeding it real food and enough food so that it doesn't go into that state. So, yeah.
Absolutely. I'm not allowed to watch those shows when I'm at home because I'm screaming at the TV the whole time.
Yeah, I would be too. All right. So that's myth number 9. What is myth number 10?
That there is healthy obesity.
Okay.
So there is a movement that there's health at every size. And so I am a really, really big fan of saying I'm treating obesity before it's to prevent its complications or to hopefully resolve the complications. I'm not treating obesity because I want a patient to be in a certain size of clothes or because I think there's a certain way that people should look.
Right.
But we know that excess adipose tissue or that fat tissue, exposure to that over time greatly increases cardiovascular risk, metabolic risk, like for diabetes, as well as functional risk for things like your joints. Not just from the size on them or the mass on them, but from the inflammation to the joints. So there have been numerous studies. There's a study called the MESA study that showed the, quote, metabolically healthy people with obesity, meaning when they first started, they had no symptoms or signs of any metabolic dysregulation. Their insulin levels were normal, their sugars were normal. Within 12 years, had metabolic syndrome. So it's not fast, but it's that long-term exposure to this increased adipose tissue that causes the damage. This is why, and I'm sure for you, it's exactly the same. It's why I treat obesity. I'm sure it's why you have this podcast. It's why I agreed to be on this podcast, because I am so passionate about people understanding that it's not about how someone looks. That's the reason I treat obesity. It's about the impact of the adipose tissue on their health.
Mm-hmm. Yes, I could not agree with you more. So I could not agree more. So I do appreciate the, because there's so much messed up in terms of body image,
Mm-hmm.
in terms of the expectations for women in our culture. But I think, it's in the Western culture that we're sort of expected to have really small, thin bodies. And so I agree with the body positivity movement that we need to accept bodies in all shapes and sizes. And if there's obesity, it needs to be treated. So it's not either or here, it's both.
Exactly.
Yeah.
And I think that's why the health at every size movement has so much power behind it, because it really is about accepting ourselves.
Mm-hmm.
And there's been so much blame and shame around excess fat tissue
Mm-hmm.
that it resonates for so many of us to be able to say, I am who I am.
Mm-hmm.
But I am who I am works great unless it's impacting my cardiovascular, my metabolic health, my quality of life.
Yeah.
And then I need it treated.
Yeah.
I don't have to be a size 6. I will probably haven't worn a size 6 since I was 6 years old. I'm probably never going to wear a size 6 again. But I want to be able to have quality of life and good health. And I want my patients and I want your audience to have that.
Mm-hmm.
And, I have a plea that I try to put in anytime I talk about obesity, whether it's to healthcare professionals, it's to an audience like you have. And that's that we all have a responsibility to help those of us living with obesity to not have the stigma and the blame around it. And one of the easy ways we can do that is to get rid of the word obese. Yes. OBESE should just be removed from every dictionary and all the language, because I'm not an obese woman.
Right.
I am a woman living with obesity.
Yes.
I live with a chronic disease. I am not labeled by that disease.
Yes.
And to me, that's a big, big difference. Saying I have a chronic disease is not the same as saying I am the disease.
Exactly.
So I would beg your audience to start thinking in terms of a person with a disease as opposed to the person being the disease.
Yes.
And I think if they do nothing else, if they don't remember a single one of the myths that I hope we debunked, if they would just do that, I would leave this knowing that something powerful came out of it. Because I just think that means so much to those of us living with obesity to not be labeled.
Mm-hmm. Yes, I correct everybody who says I'm obese. No. You're not obese. You have a disease.
Exactly.
Yeah.
Yep. You have obesity. You are not the disease.
Yes.
Exactly.
Like we wouldn't say that you're breast cancer. You have breast cancer, and you're you're not a hypertensive per se. You're somebody who has high blood pressure, right? Like you have hypertension. So the same thing is true with this disease. And the more we understand that this is a disease, and the more we look around and we see how many people are struggling with this disease, and we start to think about what's going on in this country, the more we're going to be able to do something about it.
Exactly.
So, yeah.
Exactly.
Yeah. Awesome. Okay, so let me review the obesity myths that we talked about today. And if you didn't hear the first 5, you'll have to just go back and listen to that podcast. Mm-hmm. So myth number 6 was that surgery is cheating. We debunked that big time. Myth number 7 is that you need to exercise more to lose weight. And we talked about how crazy that is. Myth number 8 is that if you just eat fewer calories and exercise more, that it's very simple and you're going to lose weight that way. And we completely debunked that one. Myth number 9 is that what's the use? It all comes back. And the truth there is that there are some biochemical adaptations that are metabolic adaptations that our body makes, but it is entirely possible to lose the weight and keep it off and not gain it back. And myth number 10 is that there's something called healthy obesity. And we talked about how that is not true, that even if you do not have any of the correlates, when you first get measured of insulin resistance, blood sugar issues, all of that, within 12 years, there is an increase in risk because of the excess adiposity. So, and we talked about how important it is to make sure that we don't say that somebody is obese, that somebody has obesity, that it is a disease. So that is a good summary. Do you have anything else you want to add, Dr. Angie?
I just want to thank you so much, Dr. Angela, for having me on your podcast. And I truly enjoy your podcast and often recommend to all of my patients that they listen to it because I think it's great information and is so positive. It just gives such a great message of you can do this and it's doable. It's treatable.
It is. It's doable. It's treatable. It requires more than you think, which is why we're here to help.
Exactly.
So, all right, great. Well, thank you again. Thank you so much for being on this. And I know you have patients to go see and things you got to get done. So I really appreciate your being on the podcast with us today. And everyone listening, thanks for listening. And we will see you all next week. Take care, everyone. Bye-bye.
Hey, if you really want to lose weight and keep it off for good, your next step is to sign up for Dr. Angela's free weight loss course, where you're going to learn everything you need to get started on your weight loss journey the right way. Just head over to JourneyBeyondWeightLoss.com/free course to sign up. Also, it would be awesome if you could take a few moments and write a review on iTunes. Thanks, and we'll see you in Journey Beyond Weight Loss.